thanks for tuning in. My name is Tony Ince, and I'm the Minister of African Nova Scotian Affairs, as well as the moderator for today's COVID-19 update. Joining me today will be Dr. Claudia Sarbu, Medical Officer of Health for the Central Zone, and RaJean Willis, licensed clinical social worker and interim president of the Association of Black Social Workers. The first part of this session will be a Q&A with Dr. Sarbu, followed by an information session on the toll-free line with Ms. Willis.
We can do our part to stop the spread of COVID-19.
Stay at home. Only go out if it's essential.
Wash your hands often, 20 seconds each time.
Want more information? Visit 811.novascotia.ca, where you can find an online assessment tool for COVID-19.
Do you have questions about employee rights? Call 1-888-315-0110.
We're in this together. Visit novascotia.ca/coronavirus for more information, or contact the ABSW Provincial Hotline at 1-855-732-1253.
Now, before I begin, I'd like to make a comment. I've witnessed great commitment, dedication, and strength by all Nova Scotians during this uncertain times. Community members have and are stepping up. They are supporting one another. And the numbers of COVID-19 are decreasing. But the journey's not over. We have to stay vigilant. We have to be cautious. We have to continue to practice physical and social distancing, as well as the proper hygiene techniques. Folks, please take care of one another and be safe. Let's begin. I have Dr. Sarbu. Now, Doctor, I hope you're ready for my questions.
Yes, I am.
Well, thank you. Well, the first question I have, Doctor, is, just give me a moment here. I lost track. Has there been any changes regarding COVID-19 social distancing measures?
So, first of all, thank you for inviting me.
Thank you.
It's a pleasure and an honor to have this conversation with you, and I prepared, as everybody can see, I have many papers here to read from, lots of information. Everybody knows that we released some of the measures that have been put in place in terms of allowing some businesses to open or reopen beaches, and I can talk about this, but in terms of the public health directives, the measures that we ask people to follow, those are still the same. And specifically, we need to still maintain physical distancing, those 2 meters apart. For now, social gatherings are not permitted for more than 5 people. It is an exception when I will talk about family bubbles, but outside of the family bubbles, the gatherings are not permitted. We still need to maintain good hygiene, washing hands, not touching our face with unwashed hands. It's a priority, and many times will help us prevent any infections. Then we need to cough and sneeze in our sleeve, and it's the allergy seasons, everybody's sneezing, but still we need to cover. And of course, it's very important, I mentioned it, but we need to avoid to touch our hands. This is how viruses enter our body, by touching the eyes, nose, and mouth.
Well, thank you. And what restrictions have been lifted, if any?
Well, I have here a long list of restrictions. So effective May 1st, we had trails, provincial and municipal parks. We had community gardens open, garden centers and nurseries, which is allowing us to do a little bit of physical activity and enjoy the outdoors. Sport fishing from shore or boat. Boating is allowed. Boating, yacht or sailing clubs can open, but only for preparing the boats for the use, not for people to get together. Golf driving ranges open, cottages can be used, and drive-in religious service with the condition that people stay in their cars and the cars are parked 2 meters apart, so we interrupt transmission. Then later on, on May 15, we've been allowed to make the family bubbles, which made everybody a little bit happier.
Good.
And May 16, beaches reopen, golf courses reopen. But again, the golf course may also have a dining room. People are allowed to use just the bathrooms, if possible, limited number of people inside, and people still cannot get together, and we have to maintain the distance. And then we have some outdoor facilities for archery, paddling, tennis, equestrian activities, and sailing. This reopened, but again, it's not with a team, it's not with a coach, it's you individually, you do your activity. And people can, if there is a facility, we can use only the washrooms and change rooms.
Thank you. So last week, the list of symptoms being screened were expanded. What symptoms should we be looking for now, and when should we call 811?
So the list of symptoms was expanded. From before, we had only 5. So beside fever, which could manifest, or we can feel the chills, the sweating from it, cough and worsening cough, sore throat, headache. We have right now shortness of breath, muscle aches, sneezing, nasal congestion, runny nose. This was from before. Hoarse voice, so because of a sore throat, diarrhea, unusual fatigue, the loss of sense for smell and taste, it's an important one, and for children and youth under the age of 19, one of the reactions of the body through the inflammation is to impact the blood vessels in the toes. So kids and youth may develop red, purple, or bluish lesions on the feet, toes, or fingers without hurting, without a clear cause. So this is a late symptom of the infection, and again, it is important if we see this in young people under the age of 19 to call 811. So 811 revised also received the revised list of symptoms, and if you have any of these symptoms, please call 811 and they will book and they will make a referral to assessment center, and an appointment will be offered for testing.
Wow. I'm surprised because, I've sort of stayed away from the news a lot, so I wasn't aware of all these additional symptoms that you could, call in on. So
well, as we did our work and across the world, of course in Canada and here locally in Nova Scotia, as we interview cases, we realized that people and their contacts, we realized that people may actually have only one symptom, like runny nose, or people may have one day of fever, or it's just a sore throat. So decision was made by a special advisory committee at federal level to expand the list in such a way that we could clearly monitor the disease and we capture any new infections so we could stop the spread.
Thank you. What does the family household bubble mean? And you referenced it earlier.
Yes, so the family bubble was a great news because it's allowing us to get together with people that we love from our family, or there are people who do not have a family in Nova Scotia. So for example, myself, I had to find friends without family in Nova Scotia, and we are the family bubble. So basically means that 2 households, it could be family, blood-related relatives, or it could be simply friends that you get along very well, but only one. So you choose one family, and this is the family bubble, and this is the only family that you have visits with. And we could go together outdoors, we could have activities, but only this family bubble. And for example, there are families with 3 or 4 kids, or you may have households who have multi-generational family in a household. So you have the grandma, you have the parents, and you have the grandchildren. Well, this could still make a bubble with another household. And if the number gets bigger than 5, it's still okay because you have permanent contact with the same members. So it's not outside the bubble.
Right.
However, there are few considerations when you think who will be my family bubble. We need to consider if we have high-risk people, people that are at higher risk in our family. And the risk could be, well, I have one of my family members works in a healthcare facility or in a long-term care or provides healthcare services at home. This person, because of the nature of the work with vulnerable people, this person should be protected from infections. So you may decide or not to have a family bubble, but if so, maybe with a small number of other people added. So healthcare workers are one, but then if you have seniors with comorbidities, again, you have to think very, very carefully who do you want to have as a family bubble. People that you could trust, they are respecting the social distancing measures in such a way that it's not putting at risk your mom or dad, or sometimes it could be brother or sister or your kids. If they have any immunocompromised conditions, we still want to protect them. So it's nice with the family bubbles, but we have to think the risk factors for our family members as well.
Well, thank you for that. You've already answered my other question about the size of the bubble and who could be in that bubble. And that's very important because I know that, there are a number of people who are a little confused by that. So thank you for clarifying, and for clarifying the fact that anybody in your home who may be at high risk, you should really consider who you're going to be bubbling with.
Yes.
So thank you for that.
This is important, yeah.
Yes. And what are facilities for golf, archery, paddling, sailing, tennis? Why are they allowed to open and not other sports like baseball, basketball,
yeah.
team
So
sports?
the rationale is that archery, golfing, paddling, boating, you can do it alone. So you don't come in close contact with other team members or with the opposing team. So for now, until we will get the sense that we maintain low level of disease or really no cases in our province, it's preferable that we do the sports on our own. And later on, if things are improving, probably the sports team will consider opening, but with good plans for hand hygiene, to have separate water bottles for individuals, so with a lot of other measures to protect the team members as well.
This is an important question because I know there's a lot in the media today and yesterday and most recently. When should I wear a mask? And, is it necessary?
So with the mask, I know that Dr. Strand had also interviews, and it was a huge debate. And people get confused because it's mixed messaging from all over the world. Some countries are recommending the mask, mandating it, like you have to wear a mask. For now, in Canada and in Nova Scotia, it is just a recommendation. For lay people, the recommendation is to wear homemade masks, to keep the supplies of surgical masks and N95 for healthcare workers who are really working with infected people and they need to protect themselves. But if you think that if you go to do your shoppings or if you go to have a walk and you anticipate that it's a little bit of a crowd there and you feel that you want to add another layer of protection beside what I said it's working and it's proven it's working. Keep your distance, wash your hands, cover, sneeze and cough, don't touch your face, then you can put the mask on. However, there are a few rules around it. You need to cover nose and mouth. Yeah, it has to come like this. And some people wear with the nose out, some people wear the mask here or hanging on one ear. No, we don't play with the mask. If we put the mask on the face, it needs to be like this. We need to, each person needs to have their own mask. We don't share with other people. We need to wash it frequently. And my concern is that the mask will offer a false reassurance to people that, oh, I have the mask and I'm safe. We have to be very mindful that we touch with our hands surfaces on which many hands have been put all kind of viruses there. So washing hands remains essential. Keeping our hands not out from touching eyes, nose and mouth, it's essential. And if somebody wants to do an exercise and watch a family member, how many times you are actually touching your face, it's incredible how many times you put.
I know.
It's very hard.
I've tried it at home when I've been at home and I had the mask on. The amount of times that I touched my face with the mask on was more than without.
Yeah.
It's strange, and just a moment ago as you were speaking to me, I had my hands right here on my chin. So, these are things that, we instantly do that we've always been doing since childhood.
Yeah.
We have to, I am more conscious now.
Yeah, everybody is, and it's amazing.
Yeah.
So, I don't have a short answer for using a mask. It is recommended if you feel you need more protection. It is recommended if you go in public and you feel you cannot avoid getting too close of other members of the public.
Right.
But remember the hand hygiene. It's essential. Don't share the mask. Wear it properly and wash hands. This is essential. For now, it's not mandated, and
Yes.
I don't know what will be the direction in the future. We need to constantly monitor what is the advice on Nova Scotia government. So if we search novascotia.ca/coronavirus, you can see all the advice, the alerts, the notices, and if this will be changed, like to ask for masks to be mandatory, I think it will be communicated publicly and everybody will learn.
Thank you. Well, Doctor, is there any other comment or anything last you'd like to say to the folks at all?
Well, I would like to thank you very much to the department, to you, to both association, HUC and ABSW, to the community members in all three communities, Cherrybrook, East Preston and North Preston. I think you guys supported public health in addressing the little outbreak we had there at the beginning of April. Was great. I met extraordinary people, and I'm really looking forward to collaborate in the future. And my message for the community is we have been successful. We definitely reduced dramatically the spread of disease in our community, in your communities, but we still need to be vigilant. Until we will have a vaccine for this disease, we are not safe. Okay, so things will reopen, businesses and etc. in certain steps and a certain interval of times over the summer. But please be mindful that we still need to do social distancing, hand hygiene. Unfortunately, we cannot give hugs to all our friends and families as we like, or shake hands. We will have to keep those expression of affection and love only for our household, because we live together with the members of our household, and for the other people we just send love from 2 meters. And I wish everybody to have a safe and beautiful summer, and I hope that in the fall, when the cold season is coming and we will have influenza and other minor colds, we will work together again, this time not to respond to a crisis, but to prevent one from happening and to work together nicely to protect our vulnerables.
Well, thank you. Thank you so much, Doctor. Thank you to you and all the health workers and all those who are on the front lines who are, doing all this hard work, extra lifting, the extra times that's put on them. I can't imagine. Thank you all so much.
Thank you.
So we'll turn it over to RaJean right now, who assists with the Association of Black Social Workers toll-free line. RaJean, how are you?
I'm great, thank you.
Great, thank you for doing this. RaJean, for those who don't know, could you tell us what the support line is and what kind of services are being offered.
So I am the interim president for the Association of Black Social Workers, and our initiative is through the Association of Black Social Workers, the Health Association of African Canadians. We have a collaborative project where the toll-free line is really our main function. And so really it came about as a result of the need to be able to offer supports and services to people who might be in need during a time of crisis, which we know a pandemic is one of those times. So through funding with the Office of African Nova Scotian Affairs, we were able to generate some funding to be able to create this toll-free line and to offer services for folks that might be in need. So April 1st was really when we received our first call from community. How the line works is that you call in, you leave your name, your number, and the reason you're calling. Someone will return your call within 12 hours and assess what your needs are and what we can offer in that time. So it's been quite busy. To date, we've had over 800 calls come in through the line. There's a number of different services that we offer. Our most popular one has been our food delivery service, and that's in partnership with the Department of Community Services. So they were able to partner with us to do shopping, provide food packaging with some of their team. We're very grateful for them, so that if people are calling in response to the COVID requirements of quarantine or to self-isolate, well, we need to give them some help so that they can, do that appropriately, right? And so, of course, if you can't get out to the grocery store, you still have to eat. So food became quite popular, and we did 3 deliveries per week to the various communities in the Preston Township specifically. We were able to obtain some more funding through other grants where we expanded that. So we looked more provincially. Majority of the people who expressed need through our telephone line came from Preston Township. However, there were people from other parts of the province also that were able to access our services. Some of the other things we offer are educational supports. So Chromebooks. Those were quite hot demand around the beginning, in particularly for the high school students, because that is something they access while they're in school. And so recognizing that not all had access to that type of technology, we were able to offer that. We've also have mental health support. So that could be around any type of mental health need. We have people on board for helping out with that. Also, public health support. So we have a consultant that we talk to learn more about what are the numbers looking like. How does that match up to what we're seeing on our phone line and the requests that people have. We also have support for medical types of supplies. So, for example, blood pressure machines. That was something that people were requesting because the access to that stuff is different now. So we've been able to assist in those ways too. So thankful for the many partners that we've had. We've had anonymous donors who have donated money, but also things like hand sanitizer, which is another thing we can offer in terms of cleaning supplies. Masks. People in the community really came together. They started making masks, and we were able to provide those to people. And the whole project wouldn't be possible without community help. And we want to really give a big thanks to them for us, our ability to really, come together. We have community coordinators that provide the delivery services for the food and supplies, educational school supplies and things like that. And also they help to rally to figure out what are the needs of the community. We do have a seniors compassionate grant through United Way. And given we're moving more into a virtual world, we have the ability to provide some technology for our seniors through tablets and internet service. So those are some of the creative ways that we've been able to. Yeah.
Sounds like you guys have been very busy.
We have been quite busy.
You know, April, and you've just listed off more than 20 things that you were doing.
Yes.
Providing supports, collaboratively with community and other organizations. If I can just go back just a little bit and ask you about the mental health thing, because for me, that, especially during this time, it's something that we should be talking about more, I believe, and we all know the challenges within our community of people not wanting to talk to people about those personal things.
Absolutely.
How important is it for us to really try to reach out and talk to somebody?
I think it's essential that we have the access, first of all, so people that are available who we can speak to when it comes to our mental health and the concerns that we might have. I think also as people of African descent, we're very relational, and so it's very challenging to have to separate from other parts of your family who may not be in your household, or even understanding, who really counts as part of my household, because we do have many intergenerational families, and you might have a neighbor that is your relative, and is that considered my household or not? And so I think we need to promote that talking about mental health is a good thing. The signs of recognition when something might not be your normal, and you might be feeling a bit off of what you usually feel like. I think it's important to name those things, and both the Association of Black Social Workers and HAWK have in the past, and really what they stand for is health and wellness.
Right.
And the promotion of that, the facilitation of that. And so I think it's very important, and I think that this is a starting, or a continuation, I should say, of the work that's already been happening.
Right.
And with this line, we do continue to have it available. So we are reducing some of our services based on the numbers that we're seeing in response to government protocols. And the fact that we've done an awesome job as community at flattening the curve. So I think that needs to be applauded and recognized provincially, maybe even nationwide. And so because of that, because of community being able to do that, and so quickly, then I think we need to keep this line open so that folks can still have a place to access when they might be feeling as though there are other supports that they need, including mental health and wellness.
So let me ask you one last question then. So given what you're speaking about mental health and being able to talk to someone, I guess you would say then it's okay to feel anxious. It's okay to feel uncertain. It's okay to feel all those feelings, right? You're allowed to feel that way.
You're allowed, and I think it's probably more common than not that most of us do feel that way, myself included.
Okay.
So I think we need to acknowledge that, yes, it is okay to feel those things, and that if they seem to be overwhelming or consuming you in some kind of way, or a loved one, that there are people available that you can speak to help work through some of that stuff. But the first step is to acknowledge it and to understand that this is something new that most of us have not experienced before in life, and even the fact of grieving comes with that, of loss. Things are different now, and we have to adjust. So on that note, I would encourage people to call our line and access supports that are available to them when it comes to overall health and well-being, questions about COVID-19, mental health and wellness, and any other supports that folks might need to get through this time and our future ahead.
Well, thank you so much. Thank you so much. You've provided a great service. Thank you for stepping up and doing what you're doing, especially given that you're going to be, giving life soon.
Yes.
So thank you so much, and have a great day, and thank you to your team
Yes.
and to everyone who has stepped up, all those first responders and all folks who have stepped up and are helping us get through this.
Yes, we're in it together.
Thank you.
Thank you, Minister.
So, once again, I'd like to thank Dr. Sarbu and Ms. Willis for providing the information and coming today. I'd also like to thank all Nova Scotians for their continued work on keeping our communities and families safe. Folks, please, I know this is tasking. I know it's a lot of hard work. As we've just had the conversation about touching your face and doing, it is a must. Try to be conscious. Try not to touch your face. Try to follow all the recommended rules about physical and social distancing, as well as proper hand sanitation and hygiene. Please, we are a great community. We are a strong community. Nova Scotia is a leader in many aspects. We have taken the bull by the horn, and we are handling this crisis collaboratively and jointly as a province and as a community. We are all getting to understand, learn, and know each other a little better. Thank you. Be safe. God bless.